This segment of DelmarvaLife is brought to you by TidalHealth.
The DelmarvaLife family is beaming with pride this week because our family just grew by one adorable sweet-faced videographer and editor. Joe Cooper and his wife Kelly welcomed their son Jameson to the world over the weekend. And believe us when we tell you, we cannot wait to kiss those adorable chubby cheeks. But to do that would put that baby in danger. That's because of something called respiratory syncytial virus, or RSV, as it is more commonly known. And we'd like to welcome to DelmarvaLife Dr. Lauren McGovern, a pediatric physician at TidalHealth Peninsula Regional. I'm pretty sure I butchered the name. Syncytial? Syncytial. Okay. Well, thanks for being here this afternoon. It's a very timely topic. And, you know, we see all of those memes on social media talking about don't kiss the babies, but that's really more important nowadays, right?
It is. So RSV is a common virus we see every fall. And RSV is different than all the other viruses. It actually does cause a little bit of clogging and inflammation of the air pipes. In babies, you can imagine the air pipes are smaller.
Yeah.
So that's why they get hit a little bit harder. I do recommend frequent hand washing and avoiding kissing the baby on the face, especially if you've had recent cold or cough symptoms, for sure.
It's obviously very, very contagious.
It is very contagious. So RSV actually can live on a fomite for up to 4 to 6 hours. So this virus actually has extreme durability and can be transmitted from a surface into somebody else. And so, you know, wiping down with Lysol wipes, frequent hand washing is going to decrease the transmission of RSV in particular because of its ability to live on surfaces.
So what causes, or what are, I guess I should say, what are the symptoms that we see?
So the symptoms I'm going to hear are they've had a runny nose, cough, cold for 2 or 3 days, low-grade fever, 100, 101, but I'm starting to see this hacking cough where they're acting like they're choking and gasping, and that's where that clogging is occurring. And so they literally are. They're trying to push out that debris, that, you know, that mucus from their air pipe. And so if you're starting to see the cold symptoms turn into a hard cough, that's different than a squeaky cough like croup, but this is more of like a hard gagging, choking. Sometimes they'll even vomit after feeding because of all the mucus and, you know, secretions they're trying to push out.
So what does management of the virus look like?
So unfortunately, it is just supportive care, but you can do a lot of things to keep them comfortable. One, the most important thing is to keep them hydrated during this. So potentially switching to Pedialyte for some of your feeds, decreasing the volume or amount of your feeds so that they can feed less volume but more frequently. Supportive care is just keeping them comfortable. Nose suctioning, we give everybody nose suctions when they go home from the hospital. Just getting rid of some of the secretions is going to help them. And you know, if there is a fever, Tylenol can help with them feeling more comfortable, which can help them keep themselves hydrated better and get them through it a little bit stronger.
Okay, so how is are the medical communities responding to the RSV?
So at TidalHealth, we have had a robust response. We have had a multidisciplinary collaboration with respiratory therapists, emergency room doctors, pediatricians to support the surge. We've been able to accommodate sicker kids in our emergency department that have been, you know, waiting to get to other facilities, and we are fully staffed and ready to help support any type of increased numbers of this virus this year.
So if I have a baby and showing these symptoms, when do I say, okay, my home care is not enough, I need to take her in?
Yeah, that's important. So we definitely want to use our primary care doctors also in this picture. They're a big part of this story. So runny nose, cough, cold, support them at home. You're starting to get concerned that things are not going well, maybe call your pediatrician, go into the office, talk to them. The reason I want you to come to the hospital is if your baby's not feeding well, if your baby's feeding less than 50% of normal, having decreased wet diapers, we might need to put an IV in to help hydrate them through this. If they're choking, gagging, coughing more frequently, maybe they have a lower oxygen saturation, and maybe I just need to come in and check that. That's the time to bring them to the hospital. Where you're starting to notice the belly muscles using to breathe, the muscles in between the ribs they're using to breathe. That increased work of breathing is a reason to come to the hospital.
Okay, and what will the emergency department do if, when I do bring my child there to be evaluated?
So our triage nurses are trained to identify like significant respiratory distress, moderate moderate respiratory distress, and depending on the degree, we'll bring you right back potentially. We'll check oxygen saturations. We'll give oxygen if needed. If patients are showing signs of dehydration, we can place IVs and rehydrate them, and we can support them through it. We try to let babies save their energy to breathe. So if we need to take away the feedings for a day or two and just supply some sugar water through the IV, we're able to do that, and that helps them get over that hump. The hump is typically on day about 4 or 5. So, we may see a child on day 6 or 7 and we're like, oh, we're past the hump, that's great. But right now, if we see a kid on day 2 or 3 who's struggling, they might even be admitted at a lower threshold because we know there's a harder day ahead.
But the good news is the babies are getting through it and they're going home.
Yeah, the great news is the babies are getting through it and they're going home, and their parents are remembering that it was a bad time that they got past, and hopefully they won't see it again this year.
Thanks to TidalHealth. The TidalHealth Dr. Lauren McGovern, thank you so much.
Yeah, thanks for having us.